Transforming cancer care is the vision the Clatterbridge Cancer Centre has in partnership with our commissioners to actually change the way cancer services are delivered in Merseyside.
I've been delighted with the services and treatment and attention I've had here.
A lot of people are quite frightened coming for their treatment, but as soon as they're greeted at the door, it's that friendly, personal touch.
This is a fantastic hospital. We're all proud to work here. We all think it's great. The patients echo those sentiments. I think when I initially heard, I was a little tiny bit apprehensive to feel like we may have been moving to Liverpool, but it was explained to me that we were growing our services.
If we were to open a new cancer centre in Liverpool, we would definitely be keeping a cancer centre on the Wirral. I think there are 3 reasons that we need to change the way we currently deliver cancer care. We're not on an acute medical site. And on those occasions where patients need beds on intensive care or need specialist advice, they're not available on site.
A large proportion of our patients live north of the River Mersey, but we're south of the River Mersey. Then it stands to reason that to have a centre north of the river would actually give them a better service.
We realised that the future of cancer probably lies in cancer research to discover better ways of diagnosing and treating cancer. We can only fulfil our potential if we have a close liaison with the university.
We're looking at how we do everything along the cancer pathway and saying how can we use this as an opportunity to improve things.
This project is planned meticulously, and it's planned with patients and carers in mind.
We want to build a new cancer centre with inpatient beds co-located with an acute hospital.
That's why we're very keen on moving the hub into the centre of Liverpool. That gives us access, especially for our inpatients, to intensive care, to cardiologists, to respiratory, to kidney doctors. So all those doctors will be on site, able to come and review our inpatients without them having to transfer to a different hospital.
By putting a new centre in Liverpool, it means that a lot of our patients will have much less distance to travel on a day-to-day basis, which we think has got to be a good thing for them.
We will have a hub in Liverpool, but we won't lose the hospital on Clatterbridge, and we won't lose the site that we've got at Aintree in Liverpool. So we'll have radiotherapy on 3 sites.
The reason we get new treatments for breast cancer and in fact any cancer is because of research. So we need research to develop new treatments. Those new treatments mean better outcomes for our patients.
Well, the new centre in Liverpool will also be very close to the university, so that will allow us to develop research links between ourselves and the university, which again will bring sort of the forefront of cancer care to the patients.
A large cancer centre in the middle of a large major city of the UK, embedded next to a large teaching hospital, adjacent to a Russell Group university. I think that will galvanise cancer research, cancer care. It means that we then have a critical mass of clinicians, scientists, nurses to do research and to drive research.
As long as we can keep the Clatterbridge ethos and keep the Clatterbridge environment, then this will be successful.
This is actually a significant investment made by the NHS, made by Clatterbridge and made by the people of Merseyside and Cheshire.
This is not going to be a PFI. We have in fact already got just under 50% of the funding that we need already secured, and that's made up of resources that we as a trust, an organisation, have built up ourselves. Resources and funding that's coming from our commissioners who fund our services. We will be going out for a charity appeal as well, and there will be a small element of short-term borrowing to fund this.
I think exciting is a good word to describe it. Starting from scratch really with a site means that you've got a little bit more say about how it's going to evolve and how it's going to work.
The most significant driver is the demands of our clinical staff, who are very ambitious in terms of the care that they want to provide to the population we serve. As experts in the field, they know the sorts of facilities which will be required over the coming decades to actually deliver the best care that we can.
The clinical design group is very important, and that comprises clinicians talking to each other, looking at different aspects of the pathway and coming up with ideas as to how we can improve it.
They're acting on information that we're giving them on what we want from the new centre, so hopefully it will give us ownership in the new centre.
This is an opportunity for us to not only catch up with the rest of the world, but maybe even to overtake it. And maybe in 10 years' time, the Clatterbridge Cancer Centre will be a world leader for many cancer treatments and areas of research.